branch. 35 years ago, we sold a small plant of dermatology and cosmetology, and it branched and branched over the years and has grown into a full-grown tree which is blooming. I am just reminded of one of the sayings in the Dhaneshwari. Ivale se ropa lavile alara yacha velu gela gaganasi mogara fulala fule vechita puna bahadunga. So today dermatology has become one of the most sought after branches because the procedural dermatology has been included in that, like hair transplant, then you have aesthetically the injectables, laser medicines, then in dermatosurgery you have vitiligo surgery, which you saw yesterday, nail surgery, chemosurgery, electrosurgery, radiofrequency surgery. So many things are being included. So it has become more lucrative, as well as many times you are stuck what to do next, and like patient is stuck with stable vitiligo and you do not know now what to do next. So that's the time when all these things work out. So procedural dermatology has become very important. Now with the dermatology becoming important, also there is another aspect which you must take into consideration, and that is what is the impact of artificial intelligence on dermatology, dermatosurgery, cosmetology. It's going to have an impact on all the branches. The artificial intelligence is nothing but it's a software which is data fed. Whatever data you feed, it is able to think like human and give you an answer. And it can scan huge amount of data in fraction of seconds. But basically it is based on what you have fed it. Now of course, earlier it was only used in few fields like defense, hospitality. Now even in the healthcare industry it is being used, especially in medicine and in dermatology. There are various trials going on in India on Indian skin because the Western people want information. So they are trying to collect, because their population, colored population has gone up. So they want to know what is happening on the Indian scenario with dermatology. So there are all studies going on of AI. Around 1975, Charles Pierce is a famous astrophysicist who came out with the Cosmos series, if you have seen it, as back in 1975 said that one day artificial intelligence will come and it will act as a psychotherapist for everyone. What you must do is you have to be in touch with artificial intelligence. You can't just say, no, I don't. You should be in touch, because don't depend upon it. Now it is applicable in about 40 to 60%. Gradually, its sensitivity and its application will increase as more and more data is fed to it. But till then, it's going to be a limited thing. So, in your routine cases, for diagnostic purposes or for even therapeutic application, you can make use of it. And of course, people I don't have to tell, you must be using it in your thesis also. But remember, just like you, your teachers are good. They have gone through the same stages. Although it is not cut and paste anymore, you are taking help of chat GPT, purposely making mistakes so that teacher will not understand, but they understand. Anyway, that was just a part of it. Now, apart from this, these are all good things about your AI. Now let us do what are the disadvantages of AI. The first impact it is going to have is that it is going to create joblessness. And this is going to be in all the fields. Because if a person can think like human being, and if the sensitivity index increases, then automatically that field is going to be replaced with AI. Same way it is going to happen in medicine also. So this is one impact which we have to take into consideration. The next impact is going to be even severe, and that is your medical legal impact. Already your patients now, they go on Google or Googleopathia, they search out the answers and they try to ask you so many questions, why not this, why not that procedure, why not this. So answering them, you have to satisfy the patient. And the cases of suing are already going up. And today as a referee when I go, at least I am able to save a few dermatologists because AI is still not come up over there. And you can get away with whatever quotations you give, and being a senior person you try to save the skin of another, your junior colleagues is fine, but it's going to be very difficult afterwards. Now imagine if in medical legal cases AI comes, it is going to be available not only to the patient who is going to sue you if he is not unhappy because you have not carried out that procedure properly. It is also going to be available, like your lawyer, it is going to be available to his lawyer. Then it is also going to be available to the judge who is going to judge you. So it's going to be very difficult to survive. Not only that, it also going to be available to the medical insurance companies, authorities and their lawyers. So your medical insurance coverage is going to be very high. That will be also another important aspect and impact. Now, of course, this is the data which is not come out in open, but it's on record. That, and they will never publish it because it's a data which is collected by the Western people. That over there, whatever data the AI has collected from the doctors, it is seen that there is a racial discrimination. And this is a shocking thing. That if a dark-skinned woman goes with a pain, she is just given paracetamol and sent out. But the same white-skinned lady goes and given NSAIDs. A dark-skinned lady who is pregnant and into labor has to wait for 2 hours, whereas a fair-skinned lady is taken up immediately. So this is racial discrimination is another very bad aspect of it. They will not publish it, but it is there. Then, of course, what is going to happen to you? So what are dermatologists supposed to do? So best now what AI engineers have found out that the branches which are visually impacted, like histopathology, radiology, dermatology, are going to feel its first impact first. And not only that, they have claimed that they might disappear. See, the word is disappear, not that it is, but it will definitely take time because now sensitivity and this thing is just 40 to 60%, it will become 70, 80, to reach 100%, it will take time. So you have still time. But like in the West, radiology is already being reported by AI. They are reporting the X-rays, CT scans, MRIs, PT scan, and even a corporate hospital in Bombay, they have started reporting with the help of AI the radiology. So the radiologists in the West, many of them have turned to interventional radiology. So what should the young dermatologists do? Okay, you see about 70 to 100 patients minimum, 70 to 120 so that your visual accuracy remains and your clinical diagnosis remains intact over the next 40 years. But apart from that, get definitely into procedural dermatology, because that will save some of your aspects. Apart from that, what should you do? My advice to youngsters is that get into small groups and go in some official places and jointly start a practice and divide the work so that the impact becomes less and it will still take a little longer time to reach official places. Now, what is going to happen on the procedural dermatology will be open to you. It will be also, the same procedural work will be also seen through AI by your competitors like general surgeons, plastic surgeons, oncosurgeons, then aestheticians, rheumatologists, internal medicinists, and worst thing is that, not worst, I don't want to say worst, but your most immediate competitor is going to be the most powerful person I feel in future will be a general practitioner who's smart enough to use ChatGPT. He will know answer to everything provided his prompting is good, and it will be because they are smart. So best is to go in a small place where it will still take time for the GP also to become smart. So these are all impacts of apart from this, what else you want to do? Because you don't want to, you are going to procedural work is going to be available to them also. So they are also going to compete. Another thing what you should not do, that I will tell. The next thing is going to be robotic surgeries. Already the robots are being used for cardiac surgery, orthopedic surgery, and it will be soon, it will come in this field also. But imagine if a corporate hospital announces available at a very cost-effective rate treatment with robotic treatment with lasers or injectables for AI-assisted facial analysis. Obviously, you will have a lot of competition and your practice will suffer. So, what you should do is try to remain away from these robotic surgeries as much as possible and work with your hands. But I always feel that your karma depends on your hands. Give you a small good lines is Mangesh Pandavkar has said about karma. He says, आयुष्य हे विधात्याच्या वहीतलं एक पान आहे. रिकामं तर रिकामं, पण लिहिलं असेल तर छान आहे. त्याचं शेवटचं पान मृत्यू आहे आणि पहिलं पान जन्म आहे. आणि मधली रिकामी कोरी पानं आपल्याच हाताने आपल्याला लिहायची आहेत आणि तेच तर आपलं कर्म आहे. सो डू युअर कर्मास वेल सो दॅट टुवर्ड द एंड ऑफ युअर इनिंग्स you feel that a sense of achievement, sense of contentment, and very happiness towards the end. I will end my speech again with a few lines of, and of course, I must say that this particular moment is going to be cherished in that moment for a long, long time. Just like it is a benchmark for this college, it is going to be a memorial thing for me also. I'll just say a few words from Baba Bolkar, which Lata Mangeshkar has sung. आता विसाव्याचे क्षण माझे सोनियाचे मन माळ ओढता ओढता त्याची करते मी स्मरण. Thank you very much. God bless you.